GI 360 is a wonderful way for your practitioner to learn a whole lot about your microbiome. It is the most advanced of the GI 360 test options through doctors' data, and it will tell us things like what your microbiome diversity is like. Do you have any traces there of viruses, pathogens, or parasites? It has an expanded parasitology and microscopy view. It'll also look at bacterial and fungal proteomics and lots of other things. So it's a really diverse and fantastic test for your practitioner and yourself to learn lots about your gut. You will have received your test kit, and let's just quickly run through what you'll see in there. Please go through your kit and make sure you've got everything before you begin. So you've got 3 of those cardboard collection containers. You have, of course, your test kit box. Please keep that, don't throw it out. There's a small freezer pack there that will need to go into your freezer as soon as possible. We'll keep that frozen in advance. You also have a courier satchel, a courier form, a requisition form with instructions, 3 sample containers there with black lids. You have 1 with a yellow lid, 1 with a white lid, and 4 plastic bags. Each of those bags also has a little gauze strip and, of course, gloves for hygiene. What do you do in preparation for this test? Well, it starts as far out as 4 weeks from collection. At that point, please do not have a colonoscopy or a barium enema. 2 weeks before your collection, do not take antibiotics, antiparasitics, antifungals, either in medication or supplement form. Also, stop taking probiotics, any proton pump inhibitors, and bismuth. 2 days before and during the collection, please do not take aspirin or Panadol or any non-steroidal anti-inflammatories. Don't take anything that will impact on digestive forms, so digestive enzymes, betaine HCl, laxatives, charcoal, bentonite clay, or antacids. There are a few key points to know. So, if you are female and you're menstruating, you can't perform the test until that has finished. Please do not collect samples if you have any active bleeding from hemorrhoids. If for some reason your bowels are a little bit slower and you're not moving them each day, just talk with your coach and make a plan. This is a 3-day sample collection, ideally back to back. And so, if you do take a little bit longer, we'll make a plan with you for that. And so, ideally, if you do move your bowels each day, you will start so that you can finish on either a Sunday or a Monday, and we'll get that courier organized for a Monday dispatch. How to collect. So, you saw in that first slide there that you've got these little cardboard collection containers. They, to me, look a little bit like hot chip containers. And so, basically, when you go to the bathroom to move your bowels, you're going to collect the stool into that container directly. It's really important not to get any urine in your sample, so just empty your bladder first and make every effort to keep the sample clean. And then pop those gloves on. Each of those little containers that have the coloured lid have got like a little scoop inside. And ideally, what we want from your sample collection is for you to take a little sample from each different part of your stool. So, some from the middle, some from each end, until you've reached the line on your collection container. So, as I said, this goes across 3 days. Now, you do have 5 collection containers. On each day, you will collect and put a sample into your black lid container. This one here does need to be shaken. And once you've done your collection, written your details on it, and shaken your collection, pop it into the clear plastic bag and keep it in your refrigerator. This one stays in the fridge. So you'll do that on each of the 3 days. On day 3 is where you'll do a little bit extra. So you still have the 1 stool collection, but also take some samples and put them into the yellow lid container. Treat that the same as the black, can be shaken and goes into the fridge. And then you've got the white lid container. This one here we do not shake, and this one needs to go into the freezer for about 6 hours at least. So if you did it on a Sunday, that's great. It can just stay in the freezer overnight. If you do it Monday morning, we need to make sure it's been frozen for 6 hours before the courier gets it. That one does go into a plastic bag that's separate from the others. So you'll notice there were 4 clear plastic bags. So there's an extra one there for your white sample. So before you start doing this test, please speak with your coach and make sure that they know to expect when to organise the courier for you. We do want to be ahead of the game with that and make sure we can get nice and early in the morning to organise the courier for you. Unfortunately, you will need to be home for the day until the courier arrives because it's unscheduled and they can turn up anytime. And once it's left your hands, it'll take up to about 4 weeks, typically 4 weeks to come back. And as soon as it's back, your team will let you know.